Well, good afternoon, everyone, and thank you so much for joining this presentation of the new Starling Oncology Nexus. I'm Dr. Jeff Langsam, the Chief Clinical Officer of Starling Oncology, formerly known as the Oncology Institute. I'm thrilled to share with you all today that Starling Oncology is launching a new prior authorization portal for our network providers to dramatically reduce administrative burden and get patients connected with their treatments faster than ever before. As we get started here, I'd like to lead off with a short video.
In oncology, every day matters. Yet prior authorization processes often create administrative burden, delays in treatment, and limited visibility into authorization status. That's why Starling Oncology developed Nexus, our proprietary oncology utilization management platform designed to modernize the authorization process and support faster access to care. With Nexus, providers can submit prior authorizations digitally, access evidence-based treatment pathways, receive real-time clinical decision support, and track authorization status through a single, streamlined experience. Nexus helps reduce administrative complexity, supports NCCN-aligned treatment decisions, and provides greater transparency throughout the authorization process. The future of oncology utilization management is here. Nexus is now available to participating providers across the Starling Oncology Network.
Wonderful. Thank you for that. So I just want to speak at a high level on some of the new benefits of the Starling Oncology Nexus. So for one sign-in, this will be a dramatic improvement over the way things exist today. So you'll actually maintain your existing QuickCap login credentials with no changes required. Additionally, Starling Nexus can be used for any payer plan. That means that you no longer need to access a different system depending on the plan. Our approaches are pathway driven. So NCCN recommended pathways with the highest level of evidence are now pre-built for selection, significantly decreasing the work necessary to select these treatments. Additionally, when one of our NCCN approved regimens is selected for use, Starling Nexus will issue a real-time automatic approval and the authorization number will be immediately available. Lastly, all elements of the prior authorization process will exist here, including document submission and real-time authorization status. Starling Nexus is designed to create a seamless experience. Next slide, please. So just one thing to mention, Starling Nexus initially will be enabled only for medical oncology submissions. Anything related to radiation oncology for those or provider groups that have radiation oncologists, things like treatments and office visits will continue to be, for now, submitted through QuickCap. And next slide, please. And just a quick high level, we talk about that automatic approval processes versus where an authorization request will actually need review by a medical director. So a provider or someone from their group will create a prior authorization request. And if the selection is for one of the recommended pathways, and that pathway is unmodified, the system will automatically approve that treatment in real time and provide an authorization number so that treatment can commence immediately. And if one of the recommended pathways, for whatever reason, from a clinical perspective, is not the best treatment for that patient, then there is the option to create a custom regimen and select various drugs and put together for a review. Additionally, if one of the recommended pathways is modified in a way that has the addition of a drug or an increase in the dose from what's suggested based on a patient's body surface area, that too will require a review, and that is how the existing process works today. One of our board certified medical oncologists will conduct a review of that case and will issue determination within the appropriate timeframes. So with that, let me pass it over to my colleague Prashant, who's here, and he'll do a live demo of the system.
Thank you, Jeff. I hope my screen is visible. Okay. Good afternoon, everyone. I'm Prashant Mehta. I'm product owner for Nexus at Starling Oncology. Today, I'll walk you through the Nexus platform. This is our landing page. We call it the orders grid. Every request your organization has submitted appears here. As you can see from here, you can search the order by patient, by authorization number, or by status. So I'll just give you an example here. I'll select this member ID. This will filter out the authorization submitted for the specific member. Now, to create the authorization, I'll click on the Create Order button. That will take me to the first step, which is searching the patient. So the approach for searching the patient remains the same. We search the patient either through patient ID or through the combination of first name, last name, and date of birth. I have used patient ID. I'm going to search the patient. When the patient appears, um, I can view the full result here, the health plan, the eligibility, and the demographics. So I can confirm I have selected the correct patient, which is on the correct plan. If I want to look for another patient, I'll click on reset. I'll enter the member ID again and search for the patient. Right. This patient is correct for me, so I'll click on create order. That will give me a full glance of the member details, which will require one more confirmation from our end to move forward with the order creation. So this selection will basically take me to provider information screen, which works much as it does today. I'll select the requesting provider here. Uh, and to select the referring provider, I can click on this checkbox so that this provides an option to carry that selection forward. If I want to select the referring provider separately, I can do type and search, and I can select the physician. So this will pull out all the required information for referring provider details. I'll keep the referring to provider as requesting provider. Uh, and then I'll click on the continue to clinical information. Um, as we move through the order, we can see a navigation panel on the left, right? I can very simply transition to what I have entered previously if I want to make any changes. So as you can see, I have clicked back on the provider information screen, which will show me what I have entered in the provider information details. If I want to make a quick update, I can do that, or I can move to the clinical information screen again. Now, this is a very key screen where I'll be filling out the clinical attributes. So we have disease group, diagnosis, line of therapy, performance status, cancer stage, and treatment intent. The behavior of all the attribute is same. Either you can type or you can scroll through as well, right? So I'll type the disease group. This will give me related diagnosis for the specific disease group. Similarly, I can select line of therapy, performance status. I will type in cancer stage. I'll also type in the treatment intent. Just to highlight this, that all these clinical attributes are required. If you don't fill out any of them, you will not be able to move forward. The system will not give you a recommendation or will not let you build a custom pathway. So as I fill out all the details, as you can see, this button has appeared, which will take me to the next screen. There is one more input, which is a priority. If your order is routine, you can keep it as is, or if it is urgent, you can click on the radio button and it will reflect urgent. I'll continue. I'll click on continue to pathway. That will take me to the order details page where I'll be able to see the recommendations. So as you can see, this is our recommendation for this specific set of clinical attributes. Uh, to review the recommended pathway, you have to click on view details. And once you do that, you will see the recommended regimen drugs with doses and certain regimen and cycle configuration detail created by our clinical team. So these two are the recommended regimen drugs, which consist of this regimen. There are two inputs which are required from your end, which is number of cycles which requires approval and number of doses per cycle. It will default have today's date. If you want to select the future requested service date, then you can select that. We have kept the usual place of service codes utilized by our team. So I can select that. If I'm good with the recommendation, I'll click on the use pathway button. Yeah. So this actually takes me back to the order details screen. So as you can see, as I've selected the recommended regimen, the status remains approved. So if I add an additional drug to this regimen or increase the dose of any drug, it will modify the recommended pathway and it will trigger the MD review. So in that case, the order will require an approval. Um, in this demo, I'll keep this as the approved pathway. I want to show another option, which is related to building custom regimen. So here, this is an option to create a custom regimen where you start from selecting the drug. You have to enter the uh, dose manually. Once you do that, it will calculate the actual dose based on the BSA uh, calculation automatically. You have to select the number of doses per cycle required. Uh, there is a comment section to make certain notes for yourself or the external provider. This is a required field for now. If you don't have anything, then you can type in not applicable right here. As it is a custom regimen, you will have to provide all the inputs. You have to add the number of cycles, the number of cycle required to be approved for, and same input as the recommended pathway, requested service date and place of service. So once you add this as a drug, you will have to repeat this process for the additional set of drugs to build the regimen. I'm not going to use it today. I'm going to go ahead with the recommended pathway. So one more nuance here, which is different from the quick cap. We have built an additional screen for supportive drugs. So all the pre-meds and hydration drugs will be present here. Again, as they are part of the recommended regimen, the approval status remains the same, approved. Uh, Same logic applies here as well. If you add an additional drug to this or you increase the dose, in that case, it will trigger an MD review. I'll keep it as it is as we want to demo the auto-approved path. So once I move ahead from the supportive drug screen, I have an option to upload the document. This is same as quick cap. You can select the category, select a document. As this is just for a demo purpose, I'm going to select anything. This note is optional. Sorry for the typo. Yeah, I'll add this and it will reflect in the list of document in the middle section. You can also add additional comments here for your reference. Now, as you can see, the submit order button is activated. It requires at least one document to be uploaded. I'll just highlight to you again. So as you can see, If I don't have anything in the document bucket, this will remain disabled. So I'll upload the document again. Yeah, as you can see, this is enabled again. Clicking on this submit order button will trigger the submission. Yeah, as you can see, the order is submitted. It is showing the uh, status, which is approved, and it will not require an MD review. So once I click OK, I'll be taken back to the order screen, and you're ready to build another order. As you can see, this is the latest submitted order. This is an authorization number. This is what we have selected as the regimen. The status is approved. We have also recorded requested service date, and it shows who has created the order. Yeah. Yes. Over to you, Jeff.
Yeah, wonderful. Thank you, Prashant. So now I want to open this up to any feedback that folks may have, any questions, and give us the time to answer them. Just a note that questions should be submitted through the chat, but if we can bring our whole team on screen, then we're happy to open the floor.
So we have our first question. So this portal is only for the actual medications and administration codes. We can continue to use QuickCap.
No, so maybe we'll pass that one to Brian.
Sure. Thanks, Jeff. So yes, that's correct. We are going to continue to use Nexus for any chemo agents and supportive medication. So as it was demonstrated on the Nexus portal, you will log in and submit orders there. For any administrative codes, we actually do not require authorization. So previously, when you were submitting required authorizations, it was really only being evaluated for medical necessity based off of those drugs. The supportive codes, admin codes, office visits, chemo infusion codes, or injectable codes, those don't require authorization.
How do we get a username and also a password?
Yeah, perfect. Great question. So Prashant, pass that over to you.
Yes. So your username will remain the same. We will be using a Microsoft login for this. You will get those details from our team. So you will receive uh, your temporary password, which you will have to set up as you do it on QuickCap. So there will be a one-time reset. Once you do that, you'll be using Microsoft authentication mechanism to log in. So from the next login, you will just have to log in through the username, enter that password, do the authentication, and you will be able to log into the portal, which I'm sharing right now.
We have another question from Patricia Walker. Is this for all insurances?
So I'll take that one. Yes, this will be for all insurances. Currently, we're all sharing patients on one of three different plans. It's Simply, Freedom, or Optimum, and all three of them will flow through this. And as I had mentioned earlier, a great perk of this system is that all three can be authorized through the same portal interface, the same login. So there's no longer a need to go to a different platform based on who the payer is.
I have another question from Nelly, Jessica, and Janet. So this site is replacing provider network for Simply Medicare.
So Brian, do you want to take that?
Sure. Yes. So the question, and your assumption is correct for that question. So this is going to replace the QuickCap portal that you are currently logging into. So the toi.quickcap.net website will no longer be the use for your chemo orders or supportive drugs. You will now be using the Nexus website to log into. And it's only for Simply Medicare. So if you do see Simply Medicaid patients or Clear Health Alliance members, you will continue to submit those orders directly to the payer.
Another question from Patricia Walker. Is this the same name as TOI portal?
I'm not sure exactly what TOI portal is referencing, if it is the QuickCap interface that Brian just addressed, but if I'm mistaken, please clarify it on the chat.
One question from Angela Jimenez. Do you have a workflow or user guide that we can reference? Are we able to receive this recording to share with team members?
So I'll pass that to Carla.
Yes, thank you, Angela. Yes, great questions. And yes, we will be sharing a Nexus experience step-by-step guide, which will include pretty much what we went over. It is a PowerPoint deck that will take you from beginning to end. And we will also be sharing this recording as well. So you will have everything that's needed to make sure you and your staff is set up. But again, also we will be providing training, ad hoc training to specific group if needed as well. You just have to send me a request via my email that I will put on the chat in momentarily, and we could set that up as well.
One question from the group, Nelly, Jessica, and Jeanette. Will the claims payments also be coming from you all as well?
So great question. Brian, do you want to address that?
Sure. So we are, Starling Oncology is the Oncology Institute or Florida Oncology Network, just to clarify. So your current processes and workflows that you have for claims adjudication or processing will continue same as usual. If you submit through EDI, continue to submit to the same address and use the same PO box if you're submitting through paper claim. However, nothing is changing from the existing process that you have for the Medicare Advantage members that you are treating. And to circle back to Patricia Walker's question as well. So Starling Oncology is the Oncology Institute. We recently rebranded on August 3rd. We did make that announcement. This was not an acquisition or a merger. We just rebranded our company's name to better align with the direction that our company is heading in. So Starling Oncology is TOI. This portal is now replacing the QuickCap portal that you were previously using.
One more question from Supal Patel. When will this take into practice?
Yeah, a wonderful question. So this will launch next week. We'll have an exact date shortly, but stay tuned for that. It will be coming out next week.
Any other questions? Patricia Walker and Supal are saying thank you. I have a question from Elise Pena. Will our current authorizations be valid?
Yeah, so Brian, do you want to take that?
I'll take that one. I'm Elise. Yes, so the authorizations that you have on file will continue to be valid. None of the authorization history is going to be wiped. It's going to be grandfathered. The platform that we use on the back end to review the authorizations and issue the letters is going to be continued to be used by our teammates at Starling Oncology. The only thing that's changing in the process is the interface that you're using to submit authorizations. The auth numbers continue to be the same format, so the letters that you receive will continue to be faxed over to your team. And if you have any questions related to authorizations, you can always call our team for support. If you have any questions, we'll be there to support you and getting your authorization questions answered.
A follow-up question from Elise Pena, or we will have to resubmit.
No, you will not need to have a service reauthorized. So anything that was previously granted will still be valid.
One question from Ileana Bolton. Hi, is this still only Pinellas and Hillsborough County?
No, so this will actually encompass any county where previously TOI, now Starling patients are sitting and our providers are seeing them. So we'll cover all of Starling's patients where we're working with this network.
Ileana, just to clarify, I know that we are only delegated for the 3 payers that you all may treat in Hillsborough and Pinellas. I'm sure that there have been communication that may have gone out by our network or by the payers themselves. We will be going statewide in October. So once that does go live and that's effective, patients that reside in all other counties in Florida will also then populate and be triaged through our portal. For the time being, until October 1st, it will really only register towards Pinellas and Hillsborough members. But again, come October, that will be updated.
There's no more questions.
All right, perfect. Well, there is certainly opportunity to ask more questions as things come to mind via email. I know Carla had made a mention that she'll be available, so certainly email anything to her and she'll triage it appropriately, and other materials will be forthcoming shortly. And then the official launch date will also be forthcoming, and we're all really excited to help make everyone's life easier and continue providing the great care that our patients are getting. So really appreciate everyone taking the time to attend the training here, and have a great afternoon.
Thank you all for attending the
Thank you,
training.
everyone.
Bye-bye.
Thank you.
Thank you.
Bye.